Before the surgery, like most people, I was scared. You know, I didn't like the idea of having my knee removed, and I don't like surgeries anyway. So that's why I put it off. I was really scared, and I hate being put under anesthesia. And after meeting Dr. Gerling and his staff at SMASA, they just kind of relieved all that fear. It just, the way he likes to get to know you, and then he tells you a little bit about himself. So it's not just doctor-patient, it's like almost a friendship. And I got the feeling that, you know, he really cares about his patients, and I just felt confident with him that he was going to do what was best for me. And his staff is great. And what really I loved was the fact that he would let me go home after the surgery. I hadn't heard of that before. For me, it was very easy. It didn't take very long. The surgery was less than 30 minutes. I went there at 7 o'clock. I was in surgery. I was the first surgery, and I was home by 10:30. There was very little pain. You know, when I first got up to walk, I thought, oh, this is going to be horrible, but it wasn't. I think Dr. Gerling is just, I think he's a gifted doctor. I think he enjoys what he does, and he's very good at it. I was so thrilled that I had finally done it, and I had gotten the surgeon that I felt really cared about me and would do such a good job, and he did. He did excellent. I can't wait to get the other one done.